Every lesson is a lyric in the universal song. Oh, the lessons of the journey, I'll weave them in my song.
Hello and welcome to Lessons of the Journey, where we discuss the stuff we actually needed to learn in school with Coach Jen and Coach Nicole.
Thank you for joining us today. We're so happy you're here. We are on our last episode of a 4 series. In the first episode, we defined stress and discussed some of the positive aspects of stress. I really liked that one.
Jen likes when we keep it positive, that's for sure. In the second episode in our series, we actually discussed why in our current society with so many modern conveniences, do we have such high levels of stress? And turns out there's lots of reasons.
Lots of reasons. In the third episode, we defined and discussed panic attacks. And another reminder, we are not experts, we're not therapists, we're not psychologists or psychiatrists. We're just a couple of women who have some life experience. We've done some research and we're happy to share.
Exactly. I do know that. And in today's episode, we're going to be talking about techniques to overcome panic attacks and anxiety. Although the term anxiety attack is used, it is technically not a medical term. It's called a panic attack. I know it's referred to often as anxiety attack. So please know if we say panic attack, we mean panic attack. If we say anxiety attack, we mean panic attacks. We may even use the terminology incorrectly. Just to clarify that, I know we did in a previous episode as we're diving into what to do as you actually suffer from a panic attack. In the moment, it shows up, it's acute, it's happening. You have all those symptoms we talked about in last episode. You've got the heart rate and all those fun things. And I say that with jest, obviously. These things mostly suck. Sorry, Coach Jen, but you're in trouble with that one. It's going to be the stuff to overcome it. And panic attacks suck. Being in them sucks. Feeling it sucks. But we want to give you some techniques because we think some of these can help.
Yeah, absolutely. And the most important thing in the moment, although if you have had a panic attack and you think, am I actually in the moment? It's important to recognize what in fact is happening. And if you've experienced one before, it may help you in the future process. This has happened. I acknowledge that this is happening. I am having a panic attack right now. Remind yourself, you're not having a heart attack. You're not losing your mind. It's absolutely uncomfortable, but it is temporary and it is not life-threatening. And realizing that in the moment and that it will pass can definitely help reduce the fear of the experience itself. And as mentioned, if you know the symptoms, that helps quite a bit. So it's that rapid heart rate, the shortness of breath, chest pain. That's why it feels like you're having a heart attack. Dizziness, sweating, feeling like you're losing control. And you may have one or multiples of these symptoms in that moment. Understanding that they are just physical responses to the fear and the stress that you're experiencing in that moment will help you detach from those sensations.
Yeah, really good advice. And if you are not sure, right, if you've never had this experience before and you're going, okay, this could be a heart attack, we are not telling you to disregard that it could be a heart attack. If that is even a possibility, go seek medical attention. Coming from the woman who went to the emergency room with gas while I was pregnant, I don't care. Don't take the chances. If you are somebody who knows about these, though, yeah, that is excellent advice. Just giving yourself a second to go, okay, what's happening, and recognizing it does make a difference for sure. Mm-hmm. And on that same note, focusing on your breathing.
Yeah.
I feel like anything, whether it's stress, whether it's anxiety, whether it's panic attacks, any outside stressor is going to give us a loss of focusing on our breath. That seems to be the first thing that goes with humans. We tend to not focus on that deep breathing. Jen's mentioned it before, taking that deep breath, cleansing out the body. How often do we do that? We are those animals that can breathe whether we think about it or not. I don't know if that's such a good thing. Focusing on your breathing slowly and deeply. Panic attacks often involve hyperventilation, that rapid, shallow breathing, and you're freaking out along with it. Acknowledge it, and you take those slow, deep breaths. Can make those symptoms much better if you slow it down a little bit. It'll calm your body. Key is to slow down your breath and engage in that deep belly breathing, literally putting your hand on your stomach and feeling the breath go in. For anybody who's taken a yoga class, you've probably done this in yoga before. So how do you deep breathe? This is really smart to know. It's just inhaling slowly through your nose for a count of 4, holding your breath for a count of 4, exhaling slowly through your mouth for a count of 4, and then repeating that cycle for a few minutes, just focusing on that. Definitely will help calm your body. Also, that focusing off of what's happening to you will calm you. That one's good. Well, these are all good.
Yeah. We call that box breathing, the 4-4-4-4. And if that helps to remember, box breathe, that's a very even keeled type of breath. My 5-year-old knows about box breathing. I would recommend, don't let a panic attack be the first time you try this. Go ahead and do this in any moment. It's so funny when I work with folks, they go, who has time for this? To get offline or take a moment, it literally takes 1 minute. 1 minute. You have 1 minute. Nothing's going to explode in this minute. You need to breathe and work on that. So when and if you need the ability, you have it. It has been rehearsed, so it will come easier. That's great, Nicole. We love our deep breathing. Thank you.
We're both slightly obsessed with
I mean, all we are required to do is breathe. That's it. As humans, we wake up, we need to breathe. It's so funny. And that happens naturally. We hold our breath when things become intense. When you're used to breathing or you go, it's time for a box breath. Go ahead and try it out. And then it's called grounding yourself. It might be overused in some rah-rah circles, but ultimately, grounding techniques help you distract your mind and it brings your focus back to the present moment. By doing that, it can prevent you from spiraling into a fear or a panic. A common grounding technique is the 5-4-3-2-1. If you can look around in that moment and name 5 things you can see, what are 4 things you can touch? What are 3 things you can hear? What are 2 things you can smell? What is 1 thing you can taste? If you have the ability, you can touch something comforting. You can hold a soft object or press your feet firmly onto the ground or touch a texture of an item near you. Focus on the sensation and that will redirect your attention away from the panic. In that 5-4-3-2-1, what you're seeing is that you're focusing on your senses. You're slowly taking in your environment through your senses, and that can help you reconnect to the present reality and minimize the emotional intensity.
I remember when my kids were younger, I used to carry one of those stones that you could rub in my pocket. When you're dealing with young children, there's a lot of stress in your life. At the time, I wasn't really suffering from panic attacks, but it was just for stress. I found if I rubbed that stone, and crystal crunch or not, no judgment here. I just think they're beautiful. So why not? This really nice, smooth stone, and I would rub it and it would keep that sensation just in the forefront. It's using those senses. There's so much value in that.
Yeah, it's self-soothing also. Use the tools. Nobody's above it. We don't need to pretend.
Agreed. The other thing you might want to think about doing if you are in the midst of a panic attack is literally challenging your thoughts. How do you shift your thinking? Some of the things that people can think are, I'm going to die, I'm going to lose control. Sometimes these happen in social situations, and I'm going to lose control of my bladder in a social situation. Like, these are some scary things that are terrifying. And instead of thinking about that, this is just anxiety. This is just me having a panic moment. It's not life-threatening. This feeling will pass soon. I've gotten through this before and I will again. That's a really important thing to say to yourself. As somebody who suffers from panic attacks, no one ever taught me to say this. It took me about 20 before I finally went, wait, I just need to tell myself, your body's just having a reaction. You're okay. You're shaking because you're getting these drops of cortisol and whatever else is happening in your body. It's just a function that's happening. It's not really an external fear of death, which in the beginning you really think it is. So talk to yourself. This is so important. Also, reminding yourself of past times when you've experienced a panic attack and it ended. This has an end. You can feel very much in the moment like this is going to be the rest of my life. No, this has an end. telling yourself that nothing harmful is happening, you're not destroying something within your body. Believe it or not, when you're going through a panic attack, this is actually a normal function that our bodies can do without any long-term harm, which may feel in the moment absolutely very different than that. Just important to remind yourself there's no long-term harm. There's nothing permanent happening here. You're not going to have detrimental things, such as if you were having a heart attack or a stroke or something like that.
Yeah. And again, if you are not sure, seek professional help. Get yourself to the hospital, because some of these do have crossover symptoms. And it may feel like in the moment, I feel like I'm going to die. How am I going to do all of this stuff? How am I going to recognize it? And I say again, do it outside of a panic attack, so that it's not the first time you're hearing yourself do this, or you're taking those breaths, or you're having your check-in or your grounding thoughts. Do this as practice on a regular. It might even help with eliminating or reducing the panic attacks if we're doing these things on a regular. And then the relaxation techniques. If you're not familiar, there's several relaxation techniques, one of which they call progressive muscle relaxation. I actually do this to help myself fall asleep at night as well. But during a panic attack, your muscles tense up. You're in shit, something's happening. That obviously is going to increase your feelings of discomfort and distress. And the progressive muscle relaxation involves tensing and then relaxing each of your muscle groups in your body. For example, if you take your hands and you squeeze them really tight for a couple of seconds and then release and relax the muscles completely, and you slowly work through each muscle group, your arms, your shoulders, your stomach, your legs, even your toes and your feet, that may help your body begin to progressively relax. Like I said, this is also a help you fall asleep technique. When you are practicing it, it helps you feel like you have a bit of control over what's happening. That is going to help you release some of the intensity of what's going on. Another relaxation technique is visualization. If you can picture something calming or a safe place or a relaxing time. My favorite thing is the beach. I always go there whenever somebody has me visualize a happy place. It's always the beach. For some people, it's a forest or, out by the lake or whatever makes you feel peaceful. And you're going to want to focus all of your attention on the details of that image. What do you see in that image? What do you hear in that image? Can you smell anything happening in that image? What are you feeling in that time? The things like that usually help you come back to the present moment as well. Staying in that present moment, that's really a key component here, huh?
Yeah, that's absolutely important. Our next one is actually remaining in the present moment. Do not try to fight the panic. That's probably one of the worst things you can do. Trying to stop the panic attack or escape from the feelings will really only increase your anxiety. Instead, the acceptance that you're experiencing a panic attack and you know that it will soon pass. Also, while staying mindful, we're engaging in mindfulness. We're focusing on our breath, our body sensations, objects around us, like we've talked about, being in that present space. This can really help you stay grounded and connected to the present rather than getting lost in the fear. This is such an important one. It is because you really do get lost in the fear when that panic attack starts happening. There's generally, for everyone that I've experienced, there is a sense that you're going to die. It's a feeling like your body is going through something you're not going to survive.
Yeah, it's impending doom for sure.
Yeah, at a really high level. A few of the techniques we talked about before that are excellent for bringing you back in that present moment. Focusing on all of these.
Yeah. Another technique, if you have the ability, because in my life, I was on the ground. I was curled up in a ball thinking I was dying. If you have the ability, if you are standing and you are able to move your body, walk around, stretch. Moving your body can help you release tension, calm your nervous system. Try to take a short walk. Take some steps. Almost sometimes removing ourselves from the place helps us move our mind around and stay mindful in the moment. If you can stretch or if you can engage in any type of light physical activity, like move your feet, that can help release the physical tension. Just any movement in your body. So I guess even if you are on the floor, if you can stretch, if you can make your body move in some way, that's going to help release some of that physical tension that you're feeling.
Yeah. Don't you find it interesting, Jen, that as we're going through these, almost all of these in some level are also ways of dealing with stress?
Absolutely.
What I love about that is if we use these and we go, okay, I'm going to deal with stress by moving my body. As you're saying this, I'm thinking, do you know how many times I've gone for a hike because I need to go for a hike?
Yes.
I just need to go move my body before I scream at someone. And I'm not in a panic attack at all. Well, menopause probably doesn't help with that one either. But I feel like a lot of these are the things that can really help with any forms of stress. Like you were saying, if we do these to deal with stress and then we actually have to deal with a panic attack, these are going to be part of our toolbox that we already have. It's going to be close to us because we've done them before. I think this is brilliant. Next one I would say is use a mantra or an affirmation. Say a calming phrase. Repeating a mantra or affirmation can help focus your mind and provide comfort. A couple of examples. I can handle this. This will pass. I am in control. This is temporary and I am safe. Safe is a great word to say because that counteracts a lot of what you're feeling. I feel like that's my stressed one. This is temporary and I am safe.
Yeah.
My family's stressing me out or whatever the stress is.
Yeah. I call them canned statements.
Yes.
That's it.
Love it. Anything that helps you feel in control. Honestly, for me, because my brain is so sciencey, I think my mantra is just simply explaining to myself what's actually physically happening to my body. That makes me much calmer. It really does. Yeah. Calming phrases, mantras or affirmations.
Yeah. I have books for my kids, Nicole. This is just reminding me of one of the books that I got for them. It came in a series of feelings and it's literally called Right Now, I Am Fine, written by Dr. Daniela Owen. And it talks about how to help children manage this type of anxiety that they may be feeling. And maybe it's not necessarily panic attacks, but I love this phrase, right now, I am fine. And this little book is so cute. It talks about a lot of what we're talking about right now. One of their management is give yourself a big hug. And that might be some of the movement of your body. And right now, I can handle this. I think that the key phrase in here is right now. Right now, I am fine. There's no cougars chasing me. I'm okay. I'm not in any danger. It's just, I can handle this, like what you just said. And then allow yourself. So what we're talking about, we never learned in school. Nobody taught me this, but now they have books for kids that help us help our children do the same type of things. You know what? I'm all for a 44-year-old woman reading this little Right Now I Am Fine book to help us understand and manage what's going on here. The stuff works. Don't let it be the first time. You've heard me say that, 3 times already? The more we have the regular practice in our life or create that mantra, do it today. If you don't have one, do it today. When you're done with this podcast, you sit down and you go, what makes me feel good? I'm going to say it to myself in these moments. And use one of the ones Nicole said, or take the Right Now I Am Fine. As long as it's not the first time, you can't create it in the moment. Have that canned statement available to you and be ready to use it when you need to. It's so funny, Nicole, you were talking about, this is all stuff we need to be doing anyway. Well, guess what? Yes, stay hydrated. If possible, in the moment of this panic attack, drink water. Dehydration can sometimes make it worse. The dizziness, the lightheadedness. If we are not hydrated, these things can become worse or perceived worse than they actually are. A cool glass of water can also help you bring you back to that present moment. Notice I said a cool glass of water, not a tepid glass of water, because it's that change in temperature. You know how a nice cold glass of water goes, ooh, that's going to bring you back to the present moment and give you something to focus on.
Yeah, very good point. I love that book, by the way. I feel the same way about things like stuffed animals, because I don't currently have any animals of my own. It's the first time we've ever not had dogs, which is really hard because I'm used to having an animal to pet. I've had a therapist before tell me, do you have an animal? And I said, yeah. She goes, does it feel good when you pet your animal? I'm like, oh, of course, pet your animal. It really helps with stress. And as Jen said, these are good things to focus on anyway, all of these things. All you need is right now, I am fine.
Yep.
And your stuffed animal, and you might just be okay. Right now, I am fine. We can all have that book. Yeah, that's what you need. Then do it. That might feel great. It is important to point out seeking support if needed. If you feel comfortable, call a trusted person, a friend, a family member, or a therapist. Talk through your experiences. Simply having someone on the other end of the phone can provide reassurance and help you feel supported. I don't know how many times we talked about support when we were talking about, why we're stressed. Lack of support was such a big piece of that. Having somebody on the other end of the phone that can provide reassurance and help you feel supported, that's huge. If you do experience frequent or severe panic attacks, you got to consider seeking professional help. There is nothing wrong with speaking with somebody who knows about this stuff. Cognitive behavioral therapy is particularly effective in treating panic attacks and can teach you how to prevent or better manage them in the future. I can speak to this directly. Yes, absolutely. Interesting how we can be experiencing something that feels so extreme, and yet one or two little tweaks in that moment can change the entire experience for us if we have access to the tools. So having access to those tools, these are some great things, but having somebody you talk to, having a therapist, somebody who knows what you can utilize, these tools, other tools, it can make a world of difference when you're in this moment. It really can. Very important.
Absolutely. Both of us are pro therapy.
Yes.
we all need it.
I think everybody should have a therapist on speed dial.
Yes.
I really do. We would have a much better functioning society if everyone had a therapist on speed dial.
Agreed. Okay. We've gone through this panic attack. It felt like we were going to die. We're having a heart attack. Maybe at the end of it, we feel like we ran a marathon. Whew. How do we recover from these panic attacks? What do we do post panic attack to recover? The primary thing I would say is rest. Rest and allow yourself to recover. As the panic attack is subsiding, give yourself time to recover physically and emotionally. I'll say it again for those folks in the back. And emotionally. It's totally normal to feel drained, fatigued, unsettled after such an intense event. Please be kind to yourself and avoid that self-criticism that will inevitably creep in, especially if you find yourself around other people and maybe a little embarrassed for having such thing have happened. Allow yourself some recovery time, physically and emotionally. Be nice. Be nice. It's okay.
Yeah, that's really important. Be nice to yourself. Generally, for me, after it happens, I feel like I just got hit by a truck. Mm-hmm. There's really no option. I'm going to hang out and veg out for the rest of the day because there's no functioning ability for the rest of the day. I just need to recover. And it's almost a forced recovery because of how exhausted I feel afterwards. But if you're somebody who does have a little bit of energy afterwards, just know you've got to take care of yourself. And what Jen said, so important, that emotionally, we've got to recover emotionally. And that means some downtime. We talked about some good downtime on our stress episodes. So definitely check that out. The other thing you're going to want to do is really reflect. Over time, it can help to reflect on your experience. Recognize what worked for you during the panic attack and reinforce the coping strategies for the future, utilizing them now, thinking about them now, because you're not going to have access to this in the moment unless it's something that's already in your toolbox, because you're just going to have the energy to go, where's my tools? If they're not already in there, you're not going to go find them. You're going to need to have access to them. So reflecting on it and helping yourself understand, that may also be a really good time to go back and go, hey, what are those techniques did I not use, but probably would have been really helpful.
That reflection is just important in life, let alone after something as intense as this experience. So once you've rested and you've allowed recovery and you've reflected on those things, it is also very helpful to track the patterns. I track everything in my life. I keep a calendar on myself. I keep notes on myself because I need to know myself the best, especially in an incident like this. If you are tracking the patterns, if you're experiencing these panic attacks frequently and you keep track of any patterns, triggers, incidences that may have led up to this. What was I eating today? Did I drink enough water today? Did I experience a stressful thing this morning? Whatever. Keep a journal or a calendar on yourself. This can help you identify and address any underlying causes, whether it's you looking back at yourself or with the support of a therapist or with a medical professional. tracking patterns in your life will help you solve any number of things that you find to be an anomaly. We do this when we track our periods or whatever's happening in our lives as women. Why wouldn't we track everything else? My mom just got done telling me about something and I'm like, well, are you keeping notes on yourself? And she went, what? No. I'm like, Mom, I keep notes about everything that's weird or different. I go, oh, what was that? What did I do today? Or what was the timing in the month? Everything. I track all patterns and I find it extremely helpful. And it certainly would be a helpful thing in this type of scenario to see if maybe you can figure out when they're going to come or how to manage them better.
Yeah, I don't track quite as well, but I do some tracking. I'm not as thorough as you are, though. All right, a couple of key reminders. Number one, just staying calm. The more you try to fight or resist a panic attack, the more intense it may become. There's so much truth in this. Acceptance in itself eases stress, panic, anxiety anyway, doesn't it? When we kind of go, okay,
yes,
it is what it is. And I can choose to react in this way or this way. I've really been focusing on the center and staying centered in my life. Of course, right now in my life is a very interesting time to try and stay centered as I'm figuring out hormones and I live on the property with my family and kids piss me off sometimes, grandkids never. They're just adorable. You know what I'm saying? This is a tough time to try and stay in that center, but there is something to be said to that. And one of my mantras, and it's funny now that we're talking about it, this is coming up. I hadn't actually acknowledged what it is, but it's I'm in control of my reaction. I get to control how I react to this situation. That's really, to me, what staying calm is. Going, okay, this is happening. I'm safe, talking myself through a couple of those things, and then going, you know what, though? I'm all good. It is what it is. And just that calmness of staying in the center and not letting the hurricane around me make me go up and down. That's not always easy to do, but it's a good goal, staying calm.
Yes, so important. And again, in those moments, it might feel like you can't. I think about this, that it is what it is. Sometimes that's tough for folks to latch onto, because there's so much judgment in the moment that you may not even recognize. Like, not right now. Right now is a very bad time for this. This can't happen right now. And we're fighting what is actually happening because we're judging so much what is happening, whether it's with ourselves or somebody else. Especially in these moments, we're like, oh shit, I'm in line at Target. This can't be happening right now. And then you try to fight the sensation instead of inviting it in, staying calm. That's such a key thing, that it is what it is. We're not judging this moment right now. It's not going to do anything for you anyway. You can judge it later in your reflection, but to track the pattern, that judgment might help you track those patterns. But in the moment, I love that, Nicole, stay calm. We could use that on any given regular.
Yeah. Big time.
And what helps us stay calm, it's that mindfulness. It's focusing on this moment right now. Those techniques that we were talking about, the breathing, the grounding, the visualizing, the muscle relaxation, all of that, that's going to help us bring our focus back to the present, and maybe help us judge a little less.
Agreed. And also that knowing it will end. That's another super important key reminder. This will probably be the last time that both of us say this, but if this is something else or potentially anything else, seek immediate medical attention. We would never tell you not to. If you know this is just you're going through, and I'm going to say all the things, a panic attack, you're having some anxiety, you're having some stress, and you know this will end, remind yourself this is temporary, this will end. Knowing that tomorrow you won't feel this way, that can really take that overwhelm in the moment away. Just really important to remember that it will end. This will end.
Yes. And also reminding yourself that your track record of getting through this, as Nicole mentioned before, really good. You're at 100% here. We've got a good track record moving through these things. Yes, this too shall pass.
I've survived all of my panic attacks.
Yeah. Congratulations. High five, Nicole. And of course, we just cannot say this enough, right? If panic attacks are recurring frequently or affecting the quality of your life, seek professional treatment. It can be very helpful in the management of this type of thing in your life. So go for the help. It takes a team.
That's for sure. Before we move into the next section, which is the techniques for chronic anxiety or chronic panic attacks, I know some of you have probably listened to the previous episode where we talked about, I have suffered from multiple panic attacks. I can't remember what my number I was at because I'm also in menopause and I don't remember numbers, but it's a lot. It's many more than the teens. One of the things recently, and this goes along with, if you listen to our episode on goal setting, we actually started that with the areas of your life, the 7 areas of your life. And one of the areas of my life that was really, really something I hadn't focused on in a long time was spirituality. And I am not a religious person. You can call it religion, you can call it spirituality, whatever works for you. I have this really cool bookstore. It's actually attached to our library, but you can buy the books because if I take them from the library, I'm going to pay for them anyway because I don't return them. I don't like the idea of having to return anything. I just donate it back when I'm done. But I went in and I found this book on the Tao, T-A-O, Taoism, and it was really interesting. And my husband and I started reading through some of the poems, and it was really focusing on that keeping centered and not being so emotionally drawn in all different directions. I have realized that when I take the time to practice that daily, it makes such a difference. And when I fall off and we don't practice it daily, just the reminder that, hey, I'm working on staying centered and not letting my emotions control me. And when I don't, boy, I can feel it. It's like, oh, wow. And I don't agree with everything. We've had a couple of things where I'm like, write NA on the top of that one. Find what works for you. My point, though, is the concept of a daily practice. We've talked about that in previous episodes, having your morning routine, you're doing your journaling or your meditation. All of these things setting you up for a successful day are going to be the kind of things that also keep you more balanced and able to deal with some of these things. I think this is something to think about. Anything to say on that, Jen?
I think that we as adults, to your point, routines, patterning, that helps every brain. It is great for children. Children crave routine. And guess what? As adults, we're just big kids. We didn't grow out of the need for routine. What we did is we developed this false identity that, oh, now I'm a grown up. Now I get to do whatever I want to do. I can have dessert for dinner. I am in control now. And so I can get away from routine because I'm seeking freedom. No, routine, in fact, is that thing that keeps you in those moments. It keeps your brain going, oh, I remember this. This is how I respond to it. And it's so necessary for all ages. Just because we're grown-ups doesn't mean that we grew out of the need for routine. So I love your point there that yes, create a routine, create some sort of ceremony, call it whatever you want to call it. I'm a word freak. Create the word that allows you to feel into what that looks like for you, whether it's a morning routine, a nighttime routine. I suggest both. Nicole and I love our calendars. Whatever routine that looks like, your brain will go, oh, and this is next, and this is next. And that puts you very much in the moment rather than what am I going to do next? I love your point there. Thank you for making it.
Just something I wanted to focus in on a little bit, and that's been helping me personally. So a couple of techniques for chronic anxiety or chronic panic attacks. We talked about cognitive behavioral therapy, CBT, relaxation training, meditation. Are we training ourselves to relax? Are we teaching ourselves the lesson? And let's be honest, as much as we want to be able to do the lesson once, I want to go to the gym once and be all fit and trim.
Yes.
Like I want to be that. But I go every day, except for Fridays and Sundays. I go every day because it takes a lot more than that one time. It's the same with relaxation. It's the same with how do we teach our body to be more relaxed? And this is not just panic attacks. This is definitely stress relief as well. How do we train ourselves?
Absolutely. And you know what? Sometimes medication is necessary. That's between you and your doctor. They have SSRIs, they have the benzos. My understanding is that they don't necessarily want to prescribe the benzo so much anymore because of society and other stuff. But if you are having conversations with your doctor and it is shown that this in fact will help you and it serves you well, can provide long-term relief, and it does so for a lot of folks. So if these other natural, I'm using air quotes, natural techniques are not necessarily serving you, get help with the medication route, because that changes people's lives. If it works and the doctor says, yeah, this will serve you, and you are paying attention to how it is serving you, all for it. Get the medication you need.
Yeah, I would agree with that.
The preventative strategies, though, too, tell me if I'm wrong. Things like practicing CBT, the cognitive behavioral, and the relaxation training, these can be preventative strategies for managing anxiety or for managing panic attacks. So this whole time we've been saying, don't let this be the first time you try it. Use the tool, then put it in your tool belt so you know what it does for you. Learning these preventative strategies for managing the anxiety or the panic attack really will help as a technique in the long run, moving forward in the ability to get through this.
Agreed. I did want to bring up one more thing for chronic anxiety, chronic panic attacks, or chronic stress. If you just feel like you're at a high level of stress, I have been taking for a couple of years now something called Ready Calm. I'm going to let you look it up. I'm going to let you do the research. It's all natural. I know it has ashwagandha in it. I really don't know what else it has. All I know is that stuff, it's a pill you take in the morning and a pill you take in the evening. It is absolutely an awesome herbal support. It has worked really well for me. One of the reasons I went on it is show me Amazon. What do all the people say? Because I want to know what are my peers saying? And there were people that were doing the heavier drugs, the benzos, the SSRIs, things like that. And they got off of them because of this. So I'll always go herbal if possible. And it really did make a difference for me. Now, talk to your doctor, figure out what works for you. You've got to, be smart about that. I just wanted to bring up that I've had really great success with that stuff. Just a great resource. I just wanted to bring it up.
Great information. I'm going to have to look that up.
Yeah. I recommend it to my dad. And he goes, yeah, I take it when I feel stressed. I'm like, this is not how it works. And take it every day. I love that. Like, so much of society is.
Yeah.
I took the vitamin. Why do I not feel better right now? Yeah, it's 60 to 90 days, dude. It's not an Excedrin.
I go, spring break, I'm going to line up all of the things. I have a stress B complex, the ashwagandha, some lipase, like all of the things. I have this whole 5-panel thing of probably everything that's in your Ready Calm. But I'm like, spring break is coming. Got to line it up now. Start taking it. Get it ready. I love that.
Because they're all going to be home. You got to be prepped and ready.
Every day, y'all. We put the work in every day. Such a good point. You put the work in every day. You establish those tools that we're talking about. Have you ever been, I'm using my house as an example, upstairs and you're like, ooh, this thing is broken. I need a screwdriver. You go down to your garage and you're like, where's that damn screwdriver? Well, guess what? If I use the tool regularly, I would know where it is when I need it. When we say put the tools in your tool belt, this is the invisible tool belt that we're carrying around with us daily. We wake up, we put the tool belt on because we don't know what it is that we're going to need and for what. And we talk about so many different topics in our podcast. This is just one of the things that could happen in your daily life that we're attempting to help give you tools to put in your tool belt. So when you know how to use them, when you know where they are when you need them, they're that much more effective.
Yes, keeping it accessible. I love the analogy of the tool belt because it would be attached to you. These are the tools they're just there. I'm going to go into actually one of my takeaways because when you were talking about the relaxation, the tensing the muscles and then relaxing the muscles, I have done that in yoga classes in the past, but I have never thought to do it during a stressful moment or during a panic attack. That's brilliant. I know how to do that. I literally know how to tuck myself through my whole body. Start with your scrunch your face, relax your face, because a muscle after you tighten it will release. Then you know what release feels like because you squeezed it. And I can tense all my muscles really well. But then it's like, oh, wow, that's what it feels like when I relax my back or my belly or whatever. I love that. That's such a great idea. And I'm going to bring that one in. That's my takeaway because I had not ever thought to do that when I'm feeling stressed or having a panic attack or having some anxiety. I love that. That's brilliant.
Yeah. And it's the progression of the muscle tensing. And there's a reason that it's a progression. It's to keep you in your body in the moment. So it's not squeeze and release. It's like my toes. And then I move to my calves. And then I move to my thigh. It's that all the way up my body to know that I am here and I am safe and I'm right here in my body. And that's the whole reason behind the progression of it. I love that. Yeah. I got to tell you, I'm the most excited learning about your Ready Calm. Oh man. Like I said, I've got the whole lineup of probably everything that's in it. But if I can take it down to one pill morning and night for the herbal support, I am all for it. I'm all for it. You know, with my mental health, I have been on the handful of drugs, and I know that that doesn't serve me well. I know a number of people who just got too deep into it and really struggled, sometimes ending their lives because the madness. So I'm with you on, if anything herbal will help, anything natural, I'm more likely to go with that and attempt that. Even so much as unorthodox. I've heard a lot about microdosing different substances that sometimes help for things like this. Again, do your own research on that. I can't speak to it personally, but I have heard that different options have helped many different folks in many different ways. Keep those options open. If you find yourself really needing the help, why not look at everything and see what serves you best?
Love that. So we started this series talking about stress. We had our first episode, which was all about the positive benefits of stress. I think that was Jen's favorite episode.
Yes.
You're like, I want to keep it positive. Okay, we're doing a stress, anxiety, and panic attack series. And she's like, can we make it positive? I think that was your favorite.
Well, I need that because in my 40 some years, my perception has been created that these are bad things. And I'm giving it a very subjective, this is bad. Stress is bad. Anxiety is bad. Society has gotten to a point to where it's like, take the drink, take the pill, do the drugs, get rid of it because it's bad. And we don't want to feel bad. It was my favorite because it allowed us to look at the flip side of it and go, oh, whereas what I thought was bad just across the board really opens up the alternative, which is what can I learn about this, who I am, what's going on in my life? And I'm all for that growth. So yeah, that's why that one was my favorite.
And it was good to do that first because we were able to take that information forward and kind of go, okay, how can we, I know I'm teasing you, but how can we keep it positive? It was good because in the second episode, which came from my brain going, how in the current moment of life, I mean, our life is literally so convenient right now, so simple, and yet we're super stressed. How is that a thing? Boy, after that second episode, I think we're real clear as to how that's a thing. A lot of stressors in the US and in the world and in current society. If we're functioning in current society with all of the modern conveniences, some of them are a little backwards in that they make our lives a little bit more difficult.
Yeah. And that helped us realize that it's all of us. It's not just you. All of us are in it together. I like knowing that. I'm kind of a scientific brain myself. I like knowing that because I'm not alone in this. The regular stressors that I feel, a billion other people are feeling them too. And I go, oh, there's some comfort in that. I'm sorry you're feeling this, and go team.
That sucks, and go team. I like that. I'm going to have to use that. Ouch and go team. We're doing it together.
We're in it together.
That's awesome. Then we went into episode number 3 where we talked about anxiety. It's a little tough talking about it. We learned some good things. And then today we finished up with panic attacks and what we're experiencing, understanding. I think there was a realization and understanding the difference. If I was to say from all 4 of these episodes, what my biggest takeaway was, it was definitely the community piece and how it plays such a massive role, an overarching role in all of this. And also just the terminology as we need to use it and have not been using it. You talk to somebody about stress and they're going to talk about how they're having anxiety and they don't realize that they're really just having stress or whatever the situation is. I'm having stress and they're actually having anxiety. I'm having an anxiety attack, but it's a panic. There's all this terminology and it gets a little jumbly. And I like having some clarity around that. I love my clarity is power. So for all 4 episodes, those are my 2 takeaways. But what would be your takeaways from all 4 episodes?
We're very simple creatures, and I go back to my basics, and I was hearing you with your takeaways, and it just hit me again how important the language surrounding all of this is. I'm very attached to the idea that you are not what you experience. You have experiences. And a therapist long ago helped me understand this about my bipolar diagnosis, which was you have it. You are not it. So you have panic attacks, and it is something that you manage. Just like if you had diabetes and it was something you manage. Just like if you had a thyroid problem and you had to take a pill every day for the rest of your life. It's something that you have and that you manage. It is not the essence of who you are. So we all have stress. We all experience stress. And to say that I am stressed versus I am experiencing stress or I have stress is a totally different animal. Same as I am panicked or I have, or sometimes I experience panic attacks. We know how to manage those things. It's just one of the many things that make us up as humans. And we all have different things. To understand that there's no judgment around whatever your thing is. Change the language, get rid of the stigma that society has surrounding it. When we can do that collectively, it will help reduce the craziness. Really, the C word is such an interesting word. That's my takeaway. If we can understand that it is an experience that we have, that we know how to manage rather than it is our essence, the way we look at it will change.
Nice. I would agree with that. All right. Questions.
Okay, this is fun. I'll go first. I'll ask you.
Okay.
This is how this question came up. I was talking to my kids, and apparently we don't do anything fun after school, even though there's parks and practices and all that. So I thought, Nicole, what was your favorite after school activity when you were a child?
Interesting. I guess I have to explain that I didn't really do a lot of after school activities. I know what my fun things were at school, and I'm trying to think what were fun after school activities we did. I always liked going to the park. If we went to the park, that was always good. And I was living in Santa Cruz when I was growing up. It was a very hippie town. The parks were cool, and we had big trees in our parks. So I think I would say going to the park. I like that. I've always been an outside and in nature kind of thing. I was never in the sports. I was never in gymnastics. I didn't play an instrument till I was older. So I'm going to go with the park.
Park is nice. All
I'll go with
right.
the park as the after school activity. And kids are so funny, aren't they? We never do anything fun. They always speak in absolutes.
I'm like, really? So I can stop paying for all the sports and stop driving you to all the different parks that you would like to experience and stop going to the beach and stop going, really? We do nothing? Oh, okay. Those beach toys that are all broken outside. We didn't do that. Yeah.
And I almost went with the beach because I'm such a beach lover and growing up in Santa Cruz, but we really only went to the beach on the weekends. But yeah, I would go with the park.
Yeah, I like it.
All right, Jen. So if you could invent a new social media app, what would it be about?
Gosh, a new one? Like we don't have enough?
That's why I thought it was kind of appropriate. That's a good one. Zing.
The first thing that comes to mind would have something to do with the collective consciousness of mental health. Because you just heard me say, we're all in it together. So if it could be something to the effect of, we all go on there and we all talk about our shit. Like this shit happened and this shit happened and this shit happened. And we all get to go, yeah, that happened to me that one time or that happened to me. And nobody gets to bully anybody. There's very specific rules. We all just share our shit. And then we go, oh, my shit's not so bad. Sorry about that one. Let's go ahead and see how we can support you there. Yeah, that would be my thing. It would be like the anti-social media thing where we all just cheer each other on and go, oh, sorry about that. How can I help you? Or, oh, wow, my shit's not so bad. Or maybe my shit can help somebody else's shit. That's clearly my favorite word right now. That would be it. I don't know how we would make it successful, but that was the first thing that came to mind. What could we call that? Your shit is my shit, or share your shit. I don't know.
That would be fun. If we have any app developers out there that want to collaborate with us, please get in contact.
As I'm saying that out loud, I'm thinking that just kind of sounds like Reddit. That's everything that goes on Reddit. Yeah. All right. You got me on that one, Nicole. I don't know.
I don't know. That's kind of reviews too. I always find myself on Reddit for the reviews. I think you're talking about more mental stuff going on. I think you're onto something. It just has to be in the right direction. Look at, see, I didn't even know that was going to, hey, new stream of income.
There you go.
We're always looking.
I love it. Well, thank you. This has been an illuminating 4 series.
Yes. Our first time doing a series. This has been fun. I'm excited.
Yeah. Hopefully somebody got something out of it.
Yes. I know I got something out of it. So if nothing else, you and I definitely got some things out of it. But yes, we hope that our listeners will get something out of it. Well, we will sign off for our 4 series of stress, anxiety, and panic attacks. And we'll chat with you all next week.
Thank you.
Bye.
Write your lines with passion, let your spirit freely roam. The lessons of your journey will lead you safe.